Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to another episode of Lunch and Learn with Dr. Barry. I'm yours truly, Dr. Barry, bringing you episode 38. And if you want the show notes, links to anything that may talk about in today's episode, like always, we're going to go to drpierresblog.com, the host of all of the episodes. But we're going to go to drpierresblog.com/LLP038. Again, if you want today's show notes, please go to drpierresblog.com/LLP038. And if you want to check out just all of the episodes, you can check out drpierresblog.com/podcast, and you will see a link to all of the episodes of the Lunch and Learn. Today we're going to be talking about rheumatoid arthritis, which is actually a follow-up to my most recent Lunch and Learn, which got a lot of attention and fanfare, so I wanted to make sure I hit up all of the points that I may have been missing on my Lunch and Learn, because I got a lot of great feedback, and I'm going to post a link to the Lunch and Learn if for those who may not follow me on the Lunch and Learn standpoint. I do that once a week, at least once a week, but yeah, usually once a week, where we talk about various topics. Sometimes we talk about topics that we actually end up doing a podcast on. We're going to be talking about rheumatoid arthritis. It's another autoimmune disease, very similar to the one I talked about on a past episode, sarcoidosis. Go ahead and check that out if you have not. I'll put a link to the show notes as well on that. And we're going to be talking about this rheumatoid arthritis, and we're going to be talking about why it's definitely something you have to be very mindful of, and definitely something that you cannot brush off. And that was something that, with the Facebook Live, that we noticed that a lot of people didn't really appreciate the severity of what rheumatoid arthritis was until that Lunch and Learn. So sit back and let's get right into another great episode. Hey, we're talking about rheumatoid arthritis today, and I wanted to approach this subject because I had been seeing it quite often in my outpatient practice with patients, usually when they were stable. But being in the hospital now, and I'm seeing a few patients who actually, end up in the hospital because of the rheumatoid flare-ups, I felt like it was, only right that we touched on this subject. And most importantly, because it's actually a topic that gets kind of misconstrued and misunderstood. And I noticed, quite well, because I used to have patients in my office when they would fill in the intake sheet, just pretty much give me an idea of what's going on. They would always mark that they had rheumatoid arthritis. And it was something that I was like, oh, wow, it's very interesting. But then when I would look at their medication list, nothing really pointed to the fact of them having rheumatoid arthritis, which really kind of helped, bring to light that a lot of my patients, and I think a lot of people too, probably in general, right, kind of think all arthritis is the same. And for those with rheumatoid arthritis, for those with osteoarthritis, it could be, further from the truth. So I initially broached this subject in the Lunch and Learns on last Friday, just to see, what type of interest we would get from there. And the response was absolutely amazing. And it was amazing because I had women, and again, I particularly really targeted the women for the Lunch and Learn, but I had women, different age ranges, different races, that all had a story about rheumatoid arthritis and when they were first diagnosed, how they were first diagnosed, and how they're even dealing with the problem, as we speak, right? And, because obviously that's just as important, the diagnosis of what are you actually doing for it. Because it's important understanding the diagnosis of the disease, but also what are you actually going to be doing for the disease? Like, what are you going to do from a treatment standpoint? And it was quite telling to see some of the people who talked about it and commented on the Facebook Live. Again, I'll put a link to the show notes just so you can kind of get an idea. Some of the response that we got, that it hit home for a lot of people. And for a lot of people, some of the, again, I'm not going to say their names. Again, you can, when you go to the Facebook page, you'll see. For a lot of people, it hit close to home because they remember going through that stage of being wrongly diagnosed or really overlooking the symptoms that they were facing and assuming that it wasn't as bad. And only to find out that, yeah, it actually is that bad, especially if you don't get any treatment done. And what you'll also notice that I talked about on the Lunch and Learn live stream was the fact that, it is an older person's disease, but, it is common and it can affect children. One of my Facebook followers talked about her child being 3 years old when she first was diagnosed with rheumatoid arthritis, but in the juvenile form, as well as another child, being 8 years old when they were first diagnosed with, arthritis. When we talk about arthritis and we talked about juvenile rheumatoid arthritis, it's actually the most common form. So for kids who are suffering from arthritis and arthritic-like symptoms, most of the time it's actually very likely that the cause is due to rheumatoid arthritis. And we're going to get into great detail of what rheumatoid arthritis is and how can you tell the difference between rheumatoid arthritis and even osteoarthritis. I don't remember doing a podcast episode, but I do remember doing a blog post on osteoarthritis, so I'll make sure I put a link to that in the notes as well. But it's something that they are troubling in terms of symptomatology, but if you ignore one, it can almost be life-threatening. So let's talk a little bit about what rheumatoid is, right? So I kind of addressed it being this autoimmune disease, right? And again, remember that word, autoimmune. Autoimmune is the body attacking itself, pretty much, right? So this is the body's immune defenses against itself, right? So it's an autoimmune disease, which pretty much means that it turns the body against itself and causes the body to attack itself. And it's an inflammatory disease, right? It tends to affect many of your hands, your feet, the hips. It affects a lot of the bony joint areas that we use quite frequently. It's chronic in nature. And from a symptomatology as far as cause, some have researched that it could be due to infection. Some have researched that it could be due to trauma, either emotionally or physical. Others have even linked smoking to be a cause of rheumatoid arthritis. And for those who've been following me, you know how much I hate the smokers and the cigarette smokers. So this is another thing we can add on to the list of, if you smoke cigarettes, you have a chance to get rheumatoid arthritis, right? Because that's what some of the studies are saying. It's not saying that it's a cause, but there's a likely possibility from a correlation standpoint. So what are the signs and symptoms of rheumatoid arthritis, right? Like we have an idea of what rheumatoid arthritis is, right? But what does it look like? What does a patient who walks into your office, what are they going to be complaining about? And if we think about it, joint pain, we talked about the hands and feet being extremely common cause for a complaint for patients with rheumatoid arthritis. Patients with rheumatoid arthritis tend to be more fatigued, more tired. And the way I like to explain that is, if you have a process that's constantly inflamed, your body will get tired of trying to put the fire out. So think about that, right? So if you have a disease course that causes you to constantly be inflamed, whether it be the joints, the hands, the feet, the hip, whether that be the case, if you have a disease course that constantly puts you in that state, you're going to be more fatigued, you're going to be more tired. What's also going to happen is you're going to have a lot of swelling. You're going to have a lot of swelling in those areas that I talked about, the hands, the feet. Some people, again, one of the commenters on Facebook talked about how her lymph nodes actually swell up every time she has a flare-up. And The way I like to explain the lymph nodes, they're like security guards, right? Like they're bouncers in front of the club, and you can't get inside the club until you pass the bouncer, right? And every time you pass the bouncer gets bigger and bigger and bigger. So when we think about what the lymph nodes and what type of role they play, a lot of the times they're almost like the bouncer, right? Like they deal with all of the stress, inflammation before it gets to the area where it's going to get to. There are also some skin issues as well for my people who are very aesthetic and my dermatologists who may be following me. Skin nodules due to rheumatoid arthritis is common in about 30 to 40% of patients, right? So nodules on the skin are 30 to 40% more likely to be in patients with rheumatoid arthritis. And there's also this big cardiovascular concern, right? There's this big cardiovascular issue for patients with rheumatoid arthritis, whether it be increasing the risk of them getting a heart attack, increasing the risk of them suffering a stroke due to excessive plaque buildup in the arteries of the heart and brain and the lower extremities as well. And anemia. Anemia is a very common trait that we tend to see from a lab diagnosis in patients with rheumatoid arthritis. Some of our risk factors associated with rheumatoid arthritis: age. So the older you get, the better chance you get it. But again, remember, I've had people who follow me say they were 3 years old, 8 years old, 6 years old when they were first diagnosed with rheumatoid arthritis. Women are 2 to 3 times more likely to suffer from rheumatoid arthritis than not. Again, that's a staggering number. So again, when I did the lunch and learn on Friday, I made a point to specifically talk to them because I know the likelihood that they would be affected was so much higher than my guys. Smoking is bad for your health, right? I don't think I even need to explain anymore. Smoking is bad for your health. Obesity has also been linked to patients suffer from rheumatoid arthritis. So obesity is another concern and cause there. So how do we diagnose it, right? So how do we say, I think you may have rheumatoid arthritis? One of the simplest tests to do, especially for patients who rheumatoid arthritis is affecting their hands, their feet, is get an x-ray. Just get a plain x-ray of the hands or the feet, and you can start telling, and it's a bad thing, unfortunately, if you do, you can start telling if they're starting to have some joint breakdown, if they're starting to have some disfigurement in their hands or feet, because the rheumatoid arthritis, again, it's a destructive disease that affects the joints, so it pretty much eats the joint away. So think about it in that case when we talk about rheumatoid arthritis and when we talk about some of the disease processes. Now, there's plenty of blood work. I can tell you there's plenty of blood work to go around for patients with rheumatoid arthritis. First and foremost, you got to test it, right? You got to test it and say, hey, are you making any of these antibodies that are associated with rheumatoid arthritis? So they do some antibody blood tests. Usually they're checking for a rheumatoid factor, whether it be the numbers or whether you just have it or not. Because there's some patients who may be positive for the trait, but their system is so low that it's not attacking anything at this moment, right? So that's definitely something to kind of wrap our heads around. The treatment course associated with rheumatoid arthritis would sound kind of counterproductive if you think about it. Is that, for one thing, I don't want my patients, becoming sedentary. I don't want that. So I need them to be as active as possible, even though there are days where the rheumatoid arthritis is, being extremely obnoxious. I need them to be able to get up and move around, because that's just important. You got to get up, you got to move. Plenty of medications for treatment of rheumatoid arthritis. You have medications like methotrexate. You have medications like Plaquenil. You have medications like steroids. All of these play a vital role in making sure that the rheumatoid arthritis is kept in check. And the reason why that's so important, because we understand that for some patients, they may have rheumatoid disease, but they may never get the flare-up. And then you have some patients who do get the flare-up. So it's definitely important for us to note, which one is which, and, how to make sure we are in lockstep with trying to control the problem, right? Because the problem is your body is attacking itself, right? We talked about autoimmune. The body is attacking itself. So you have to get medications to tell your body to stop. Tell your body to stop doing what you normally do. And if you kind of understand that process and that workaround of how to treat rheumatoid arthritis, you understand that a lot of these medications can sometimes be considered chemotherapy type medications, because chemotherapy medications do pretty much the same thing. They tell the body, stop making that cell that's making the bad cells go around, right? Like pretty much, and here on the Lunch Learn with Dr. Barry, I try to make things as simple as possible, because I want you to kind of be able to understand it, to ask more questions later, right? I want you to be able to kind of get a big picture of it so we can talk about it, and you could talk about it with your primary care doctor at a later time. There are some treatments from a surgical standpoint associated with rheumatoid arthritis, but I can tell you most people never get to that point. And what's interesting, especially in our setting from rheumatoid arthritis, treating rheumatoid arthritis, is that we see a lot of patients, right, kind of disregarded, right? And that was I'm not going to say it's a common theme, but that was something that I did note on the Lunch and Learn, that there was a few people who may have been diagnosed with rheumatoid arthritis, but wasn't really taking their medications. They weren't having any flares, so they didn't feel the need to do so. And, that's where we have to be very mindful of, and especially when we're giving these types of medications, to make sure we don't, build up any resistance or anything in that regards. So that pretty much was rheumatoid arthritis. Again, with our quick, rundown, it's this autoimmune, inflammatory, chronic disease that affects the hands, the feet, pretty much even your hips too. And for signs and symptoms to look for, think about joint pain, weakness, fatigue, risk factors associated. If you are older, you are likely to get it, but that doesn't mean the young folks can't get rheumatoid arthritis. If you're a woman, again, women 2 to 3 times more likely. If you smoke cigarettes, right now, if you smoke cigarettes, stop smoking cigarettes. That's all I gotta tell you. There's really no other. I hate to go on these caveats for cigarette smoking, but sometimes you have to. There's really no reason for you to still be smoking cigarettes unless you're literally addicted to smoking cigarettes, right? And we have plenty, gums and patches and things we can do to kind of get rid of that. So, and from a diagnostic standpoint, we're going to order some x-rays, we're going to do some blood work, and just kind of wait for those things to come in. But I can tell you that there are some patients, who we have to, be very mindful of when we're treating rheumatoid arthritis, because we don't want to cause any other problems. Again, we talked about it being a chemotherapy type medication. So if you have certain diseases, you can't even start the treatment or the treatment for majority of those medications on for rheumatoid arthritis because of it, right? So it's definitely something to keep an eye on, definitely something to follow with your doctor on if you're having any concerns, that may be dealing with symptoms of rheumatoid arthritis but have been calling it osteoarthritis all this time. So I'm going to see you guys next week for another great episode. We're going to be talking about breast cancer, breast exams, and just really getting the job done when it comes to the breast, right? So stay tuned, and you guys have a great and blessed day. Bye. And if you want today's show notes, please go to drpierresblog.com/LLP038. Again, if you want today's show notes, please go to drpierresblog.com/LLP038. Don't forget to head over to iTunes and leave us a 5-star review and let me know what you think about today's topic. And if you have any personal stories that you may want to, let the world know you don't have no problem with, go ahead and drop a comment on the website. Again, at the same website, drpierresblog.com/LLP038, or leave it on the Facebook page. See you guys later. Bye.
Thank you for listening to another episode of the Lunch and Learn with Dr. Barry. I want to say thanks again for all that you guys do and all of your support and all of your listens. So I want you to kind of keep on keeping on with going ahead and sharing today's episode. Go ahead and subscribe to the podcast if you're not already subscribed to the podcast. Follow me on Instagram, Twitter, and Facebook, all at the same name, Lunch Learn Pod, and go to the website again, lunchlearnpod.com, for all of the episodes if you've missed one. And again, I'm at all of the favorite podcast apps: Google Play, Stitcher, SoundCloud, and of course Apple Podcasts, where I would love a 5-star review and tell me what you think about today's episode. I would love to hear it. So I'll see you guys next week. Bye.